And we're back on this Saturday morning, Sports Medicine Weekly. Steve Cashel, Dr. Brian Cole. Our website is sportsmedicineweekly.com. Producer is Shane Reardon, and that leads us to our staple of the show. We do it each and every Saturday here on Sports Medicine Weekly, our Ask the Doctor segment, giving our listeners the opportunity to have Dr. Cole address their specific sports injury issues. Now, it's very easy for you to submit a question. Just go to our website, sportsmedicineweekly.com, and on the homepage of our website, you're going to find a link underneath the photo of Dr. Cole and yours truly. On the right side of that homepage, just click on that link and you can submit your question. So, Dr. Cole, I got a couple good ones today for you, and they're very timely as well. First one is, Dr. Cole, I assume when you operate, you are in a sterile environment. Does anything change in your procedures due to COVID?
Yeah, of course, the operating room is sterile, but there's some processes that are, in place now that we never considered before, Steve. I mean, the first one is if you were a patient, if you remember when I did your bicep surgery, we have no family members that come with the patient to the operating room area. Everyone has their temperatures checked, and they undergo a screening tool for the high risk questions, travel and contact with people that are known positive and symptoms and so forth. And then everyone is wearing masks, which wouldn't be the norm outside the operating room. And then in the operating room, our processes are different. Now, the operating room has the ability to recirculate air. And so it's actually a very good environment where the air recycles very quickly over a short period of time. The highest risk situation in the operating room is at the time of administering anesthesia, and the methods basically provide the anesthesiologists basically use a shield, if you will, between them and the patient to prevent exposure to respiratory secretions. So we have precautions in place now in terms of time between room cleaning and things of that nature, but everything else feels and looks the same. And we have what we call universal precautions. So we just assume there's a possibility of anyone being positive, despite the fact, and I left this out, that everyone gets tested within 72 hours. So if you were to have surgery now, you would be tested with the nasal swab. The results would be available within 48 hours typically, and maybe long as 72. And I would ask you to sort of self-quarantine to minimize your exposure between the time of that test and the time you come to surgery. So that would be a part of it. So at any rate, things have changed, but we feel very safe, and I have said many times over the last couple of months, Steve, I feel very safe seeing patients and being in surgery, sometimes safer than unfortunately going to the grocery store, because I think we all can't forget that we still have to continue with social distancing in a proper way, as well as the masks at a time where you might be in close contact with someone.
And adding to that, Dr. Cole, off my top of my own head here, a question. Is anyone, they're nervous about getting, surgery done? It's a pretty safe environment, isn't it?
I mean, I have had to speak with a lot of patients to explain the same processes I've explained to you, because it's not clear, and I think patients, especially who are higher risk, are very worried. Most of what we do is in an outpatient, non-hospital setting that is not taking care of COVID patients. So we have no problems with PPE. In other words, we have all the proper protective wear. We have staff that's dedicated to the ambulatory surgery environment, and none of us are managing patients with that are known to be COVID positive. We're not taking care of this patient group. So the center is what we call a clean center, and that's really important. So I think, as I say, I think the risks are incredibly low. Now, there are some surgeries that do require inpatient stay, and some surgeries that might even require an ICU bed. And while that's still safe, there are some logistics in terms of hospital capacity that have to be assessed on an ongoing basis based upon the executive order from our state in Illinois. So, but beyond that, in the ambulatory setting, it's a very clean setting that is not managing patients who are known to be COVID positive. So I feel very comfortable going to work every day, to be quite frank.
Great stuff. Okay, and I've got another question here from one of our listeners as we continue with our Ask the Doctor segment. Again, I'm Steve Cashel with Dr. Brian Cole. It is Sports Medicine Weekly here on The Score. Here's a question from a listener, NBA fan, obviously. Says, Dr. Cole, the NBA will resume with 22 teams. The Bulls are not in it due to their record. So how does this affect the Bulls players and your role with the squad going forward?
Yeah, typically, Steve, in an off year where we didn't make the playoffs, if it's an away game, we're doing exit physicals on the plane or the next day, and players are kind of anxious to have some time off. In this setting, there's a lot of scatter right now with where people are. So, the basics, basically our season is over, and the NBA will now enter the playoff mode in a closed setting in Orlando, and for 22 teams. But for us, the season being over, I have to do some form of exit physicals, which means we just want to make sure that all the issues that were active during the year are addressed. Players all their healthcare needs are met, that they have a healthy off season, both from an exercise and fitness point of view, but nutrition and any medical problems that may have been active. And then we're going to have to start thinking about how, when free agency and trade deadlines, all of those things are kind of in flux, and then the combine, when the players get evaluated, there still isn't clear on how we're going to manage that as well. I mean, typically, Steve, we would have everyone come to Chicago, and we would have the combine, and there'd be 60 some odd players and a lot of people coming through Chicago, and all the team physicians in the same place, and each player would be examined by every physician, and there's a lot of physical contact, and it's pretty obvious that that's not going to be how we'll be able to do it this year. So looking at ways to address that, I think it's still, the plans are not codified at this point, so that's kind of a wait and see, and I don't have a lot of insight on how it's going to get done, but it's probably not going to look exactly like we've been doing it for the last 20, 25 years.
And Dr. Cole, to that point, is there an advantage, a silver lining in this, maybe we can't get into specific injuries, obviously, protect the players and their families and the team, but even for Bulls players, maybe guys that were coming off injury, to get some extra needed rest right now, not get into what some players maybe weren't coming back this year?
Yeah, I mean, I think what it does do, and it's the same thing it did for players who were coming back, as we know, who were out after injury and surgery. So any players that's had treatment, some of them surgical, they have had the added opportunity to get better. And then depending on where they are in their free agency, if their contract was up, they now have the ability, with time behind them for healing and reconditioning, to actually show that they can be successful return to the sport. The biggest challenge when you have injury or surgery is having enough time pass where you can actually show that it's been successful and that they can return to sport. And these timelines are always compressed at the end of the season. So now I'm seeing athletes, not only just from the Bulls, but really from many teams, that we're able to treat them, and they have a much more liberal time frame, because we're talking, season end to October, November. That's an awful lot of time before a season resumption to actually get a sense of how good they're doing. So having a little more liberal time frame, I think, is going to open up opportunities for guys, especially who have otherwise, very compressed time schedules due to free agency.
And Dr. Cole, I know you you have, at least in the past, sat on boards with the other NBA doctors. Do you guys continue to converse, whether it be by conference call or Zoom meetings? NBA docs continue to get together?
We do. We've had, there's been a number of Zoom calls, like all of the, every, major sports enterprise is doing, everyone in life is doing these Zoom calls, and that's how we've continued to communicate with the league. And they've been pretty amazing in terms of, I don't want to call it over communicating, but this is a situation where they've done an amazing job at keeping people engaged and providing real-time information. And it's important, especially in sports, because, there's misinformation, and the media may grab a tidbit of information but not know the whole backstory, and things kind of get out of control. And they've stayed ahead of it, I would say, in an unprecedented way, especially at a time where there's no script. I mean, Steve, it's like one week there's a plan, and the next week we have a different plan based upon something we learn. But the communication has been pretty phenomenal, and I would say that I feel as informed as I've ever felt, given the leadership that they've shown.
And final question before we say goodbye on this edition of Sports Medicine Weekly, Dr. Cole. Do you, as NBA doctors, share information a lot between different scenarios, and kind of take advantage of each other's complexities and knowledge?
In the NBA, there's a council that's sort of a second opinion council that is very useful to have sort of get unbiased second opinions. Adding that to which we always encourage, adding that to the collaborative nature of the way team physicians are. It is not infrequent for us to call one another and say, hey, listen, have you seen this? How have you managed this? Let me send you some MRI images and so forth, because we all are sort of a victim of our experience, and some of us may have seen a lot of one thing and not a lot of another. So the years of experience by physicians, 10, 15, 20 years, some of these guys have seen everything. And that's one of the greatest parts of this job, is the decision making is actually really interesting, and it's far less about a surgery, and it's much more so about making the best decision. And that's that really is just patient care. It's not just to a professional athlete. So these I would say there's a wealth of knowledge across the NBA that we've all consistently been able to leverage and get to run various problems and situations by, to get greater insight. So that's been a huge advantage.
Okay, Dr. Cole, we're out of time. Great stuff. Continued success and good health to you and your family and your patients.
Likewise, Steve. You as well. Have a great week, and we'll talk next week.
Absolutely. Our thanks to our producer. He's Shane Reardon. Also want to thank Dr. Cole for joining me this week, and his dad, David Cole. He manages our website and our business operations. And then we thank Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Cashel saying so long. We thank you for listening to Sports Medicine Weekly, and we'll be back next week with a brand new edition of Sports Medicine Weekly at 8 a.m. only on
670 The Score.